Okay, if you share your life with a cat, maybe one that's a bit too curious. Or honestly, even if you just live somewhere that uses pest control, you really need to listen to this.
Mm-hmm.
We're doing a deep dive today on rodenticides, rat poisons. They're kind of everywhere.
They really are.
And what our research turned up is, well, it's pretty scary. There are different types, chemically different, that need completely different emergency treatment.
That's exactly right. Get it wrong, mistake one for the other.
And it could be fatal. Yeah.
That's the stark reality. So our mission today, for you listening, is to really cut through the potential panic. We want to give you a clear, clinical breakdown of two major types of modern rodenticides,
Right.
hypercalcemic agents and bromethalin. We need to zero in on how they work differently, how fast symptoms appear or don't appear, and crucially, why the emergency vet care is basically poles apart.
Knowing the difference between, a calcium crisis and a brain swelling crisis.
Precisely. That knowledge is absolutely key for the vet to intervene effectively and for you to know what to look for.
Okay, let's unpack this then. Let's
Yeah.
start with that first one you mentioned, the hypercalcemic agents. Our sources often call this the vitamin D threat.
Yeah, and that name can be confusing, can it?
Definitely. Vitamin D sounds healthy, sunshine, supplements.
Right. But this isn't about nutritional levels. This is weaponized vitamin D, specifically cholecalciferol, a very potent form.
Weaponized. How? What's the mechanism?
Well, it's sort of metabolic sabotage.
Hmm.
Vitamin D's main job in the body is regulating calcium absorption. These poisons contain massive, overwhelming doses.
Okay.
So it forces the cat's body into hyperabsorption mode. It just sucks up way, way too much calcium from the diet, flooding the blood serum with it.
Mhm.
Toxic levels of calcium.
And that leads to, hypercalcemia, right? Too much calcium.
Exactly. Systemic calcium poisoning.
Now, here's something interesting our sources pointed out from a pest control angle. This vitamin D type is actually becoming more popular.
That's true. And there's a specific reason for that.
Rodent resistance.
You got it. Rodents have developed significant resistance to the older anticoagulant poisons, the blood thinners, but they haven't developed resistance to vitamin D toxicity,
So it works really well against rats and mice,
making it a go-to for pest control companies now.
which unfortunately bumps up the risk for pets in those environments.
It does. Though we should clarify something about how cats usually get exposed.
Okay.
It's generally not from eating a poisoned rodent. Secondary poisoning is less common for cats with this type.
Really? I thought that was the main risk.
Well, the dose passed on might not have been high enough. For a cat to get seriously ill from these hypercalcemic agents, they typically need to ingest the bait directly.
Okay. So finding the bait itself chewed on is the big red flag.
That's usually the scenario, which
Mhm.
makes bait placement, where they put it, incredibly important for safety.
What makes these vitamin D poisons, these hypercalcemic ones, particularly insidious, I guess, is the delay.
Yes, the timeline is critical to understand. This isn't like some poisons where the reaction is immediate and obvious.
Or no violent sickness right away.
Exactly. The signs of hypercalcemia are significantly delayed. We're talking 18 to 36 hours after the cat eats the bait.
18 to 36 hours, that's a day and a half later.
Correct. So you might see your cat, maybe they seem a bit off, maybe not even, but you assume they're fine. Meanwhile, internally, this calcium overload is starting to wreak havoc.
While you're sleeping, essentially.
Potentially, yes. And when the clinical signs do finally hit, they reflect that widespread damage from toxic calcium levels.
What should owners be looking for then after that delay?
Initially, increased thirst is a big one, and frequent urination. That's the kidneys desperately trying to filter out all that excess calcium.
Okay, thirst and peeing more. Got it.
Then it progresses.
Mhm.
Vomiting is common. Generalized weakness, lethargy. Muscle twitching can start.
Twitching, okay.
And in the really severe cases, as the calcium starts depositing in soft tissues where it shouldn't be, you can see seizures. It causes irreversible kidney damage, calcification, and ultimately, the heart gives out. Fatal cardiac arrhythmias.
That's terrifying, especially with that long delay before you even know something's wrong. Let's pause on that 18 to 36 hour window. That feels like a huge period of uncertainty. If you suspect ingestion, what can you do?
Right. Even with the delayed symptoms, the clock is still ticking on treatment effectiveness. Time is still critical right after ingestion happens.
So if you find chewed bait packaging, or maybe the bait block is missing.
Yes. If you suspect ingestion and it's been within, say, the last 4 hours or so,
4 hours, okay.
that's your window for immediate action. The first step is to induce vomiting. But you need to do this safely. Call a pet poison helpline or your vet immediately for guidance on how to do it, or if you even should.
Get professional advice first. Don't just guess.
Absolutely. And then get to the vet right away. Even if you made the cat vomit, that 4-hour window is the best shot at getting the poison out before it's fully absorbed.
Okay, induce vomiting within 4 hours if advised, then straight to the vet. What happens if that window closes or once you're at the clinic? The treatment changes then, right? It's about managing the calcium.
Completely. Once absorption happens, or if you're past that initial window, decontamination is less effective. The focus shifts entirely to fighting the systemic effects of the hypercalcemia.
And the sources described a pretty complex, multi-pronged approach for the vets.
It has to be. You're essentially trying to save the kidneys and stabilize the heart while getting those calcium levels down fast.
How do they do that?
It's usually a combination therapy. Aggressive intravenous fluids are crucial high rates to try and flush the calcium out through the kidneys via urine. Diuretics are often given alongside the fluids to help that process.
Okay, fluids and diuretics. Makes sense. Flush the system.
Then often they'll use prednisone, that's a corticosteroid, and it helps reduce calcium absorption from the gut and helps the kidneys excrete it.
Prednisone too, wow.
And sometimes oral phosphorus binders as well, to further limit any ongoing calcium absorption from anything still in the digestive tract.
That sounds like a really intensive treatment, a lot of intervention. Is there a risk of, I don't know, overwhelming the kidneys, trying to flush everything so hard?
That's a very good point. It's definitely a balancing act for the veterinary team. They have to monitor kidney function very closely. But the alternative, letting the calcium deposit in the kidneys, is worse. Aggressive fluid therapy is actually protective in that sense.
Right, prevents the kidneys from calcifying.
Exactly. And even for cats who survive the initial crisis, it's not necessarily over quickly. Our sources note the effects of that elevated calcium can linger for weeks.
Weeks, even after they seem better.
Yes. Follow-up blood tests are essential, and many cats need to be on a special low-calcium prescription diet for quite a while to prevent recurrence or further damage.
Okay, long-term management is key too. Now you mentioned, or rather the sources mentioned, an antidote, calcitonin.
Ah, yes, calcitonin. It is a specific antidote that can rapidly bring down serum calcium levels.
So that sounds like the magic bullet.
Well, there's a big but. The sources are pretty clear on this. Calcitonin is often very difficult for a typical veterinary clinic to get hold of quickly. It's not always readily available.
Availability issue.
Big time. And even if they can get it, its effects are quite short-lived. It helps temporarily lower the calcium, but it doesn't fix the underlying problem or last long. It's more like a temporary bridge.
A bridge while the other treatments, the fluids and diuretics, kick in.
Exactly. It can help stabilize a critical patient, but it's not a standalone cure. You still need that comprehensive supportive care.
Okay. So, hypercalcemic agents. Delayed symptoms, blood calcium overload, treatment is fluids, diuretics, maybe prednisone, maybe calcitonin if you can get it.
Got it.
Let's completely turn gears now.
Right. Different poison, different mechanism.
Because the second major class we need to talk about, bromethalin, is, well, it's a whole different beast. If the first one was a slow burn blood chemistry problem.
This one is a direct hit on the nervous system.
Bromethalin. Okay.
Yeah.
How does it work? Nothing to do with calcium.
Absolutely nothing. Bromethalin targets the central nervous system, the brain and spinal cord. Its mechanism is pretty frightening, actually. It causes edema.
Edema. Like swelling.
Exactly. Fluid buildup and swelling within the actual cells of the brain and spinal cord.
Swelling inside the brain. That sounds immediately bad. Why is that so dangerous?
Well, the skull is a fixed space, right? Swelling increases pressure, which is bad enough, but specifically, bromethalin disrupts the energy production within those nerve cells. It interferes with something called oxidative phosphorylation.
Oh, okay, fancy term. Meaning
the cells can't make energy properly. They swell up, pressure builds, blood flow gets cut off, nutrients can't get through. The nerve cells basically get damaged and die off.
yikes. And that leads to neurological symptoms, I assume?
Directly and often rapidly. Unlike the vitamin D poisons, bromethalin's effects can be quite fast, depending on the dose ingested.
So what kind of signs are we talking about if it's hitting the CNS?
It can be dramatic. In severe cases, you see things like paralysis. Hind limb paralysis is pretty common in cats.
Paralysis, really?
Yes, or seizures, muscle tremors. Sometimes the cat loses the ability to control basic functions, like urinating, just unable to go.
Wow. Okay, so severe, obvious neurological signs. What about milder cases?
If the dose was lower, the signs might be less severe, but still clearly neurological. You might just see ataxia,
Ataxia. Like a...
lack of coordination, stumbling, staggering gait, weaving when they walk, seems drunk or unstable. That rapid onset of neurological signs is a huge clue. It might be bromethalin, not the hypercalcemic type.
Okay, rapid neurological signs versus delayed systemic illness. Big difference. Let's jump right to treatment then, because you said earlier the treatments are poles apart. If you suspect bromethalin, what's the absolute priority?
The immediate difference is stark. If you catch it very soon after ingestion again, that rough 4-hour window is often cited.
Okay.
Inducing vomiting is still potentially the first step, if safe and advised by a vet. But the absolutely critical follow-up step, unique to bromethalin and similar toxins, is activated charcoal.
Activated charcoal. Why is that so important here?
Because bromethalin does its damage once absorbed. Activated charcoal acts like a super sponge in the stomach and intestines. It binds the toxin molecules before they can get absorbed into the bloodstream and reach the brain.
So it traps the poison in the gut.
Precisely. It's a key decontamination step for this type of toxin, much more critical than for the hypercalcemic agents, where the issue is managing absorbed calcium.
Okay, so induce vomiting maybe, but definitely activated charcoal ASAP. Then what? Once the cat is at the vet and hopefully decontaminated.
Then the focus shifts to managing that brain and spinal cord swelling, the edema. There's no direct antidote for bromethalin itself.
Right.
So treatment becomes supportive care aimed at reducing that dangerous swelling and managing the neurological symptoms.
How do they reduce brain swelling?
The sources suggest veterinarians might use specific types of fluids or medications like mannitol to help draw fluid out of the brain tissue. Corticosteroids, like prednisone again, might also be used for their anti-inflammatory effects to reduce swelling.
Steroids again. Okay.
And interestingly, some sources mention that supplements like ginkgo biloba might offer some neuroprotective or anti-inflammatory benefits, though that's likely more supportive than primary treatment.
Ginkgo, huh? Okay, so manage the swelling, support the systems.
Essentially, yes. Provide supportive care fluids, nutritional support, managing seizures if they happen, while the body hopefully processes and eliminates the toxin.
Now, there is a really critical warning in the material about trying to give things orally once the symptoms have started with bromethylene.
Yes, this is absolutely vital for owners to understand.
Yeah.
Once those neurological signs appear, the paralysis, the severe ataxia, the inability to control movement,
Yeah.
it becomes extremely dangerous to try and give anything by mouth. No water, no food, definitely no medications.
Why is that? Choking risk.
It's worse than just simple choking.
Mhm.
Because the neurological damage affects the cat's ability to swallow properly, their gag reflex might be impaired.
I see.
So if you try to force liquids or meds down, they're very likely to inhale it into their lungs instead of swallowing it. That leads to aspiration pneumonia.
Which is a whole new, potentially fatal problem on top of the poisoning.
Exactly, a devastating complication. So once neurological signs are present, all hydration, nutrition, and medication need to be handled by the vet, usually intravenously or through other safe routes. No oral administration at home.
That's a crucial safety point. Okay. And if a cat survives this neurological onslaught, what's the recovery like?
If they pull through the acute phase, and hopefully the neurological damage isn't permanent, recovery is often slow.
Not a quick bounce back.
Definitely not. It can be a marathon. It might take weeks, even months in some cases, for the cat to fully regain coordination, strength, and normal motor function. It requires patience and continued supportive care.
Weeks or months. Okay, so let's try and synthesize this for everyone listening. What does this all boil down to for you, the pet owner? We've clearly got two very different poisons here, right? Hypercalcemic agents. That's the vitamin G type. It's like a time delay bomb targeting blood chemistry.
Right. Calcium overload, delayed symptoms, 18-36 hours.
And the treatment involves aggressive fluids, diuretics, things to flush out and lower calcium.
Correct.
Then you got bromethylene, totally different. An immediate attack on the central nervous system,
Causes brain and spinal cord swelling. Edema.
leading to rapid neurological signs like paralysis or ataxia. And the critical treatment there is rapid decontamination, especially with activated charcoal, followed by supportive care to manage the swelling.
That's the core difference. Calcium overload versus brain swelling. Different causes, different signs, different treatments.
So connecting this back to the bigger picture,
Yeah.
What's the absolute number one takeaway for someone listening right now?
The absolute necessity, if humanly possible, is to identify which poison was ingested.
Find the box, the bait.
Yes. Look for the packaging. Note the brand name, the active ingredient listed. Note the color or shape of the bait if you see it. Bring the package or a sample of the bait to the veterinarian if you can do it safely.
Because the treatments are so fundamentally different.
Fundamentally, you can't treat brain swelling with diuretics meant for high calcium. You can't skip activated charcoal if it's bromethylene. Telling the vet, I think my cat ate rat poison, isn't enough.
You need to give them more.
Knowing or even suspecting which type allows them to initiate the correct life-saving protocol immediately. Asking for a calcium blood test versus demanding activated charcoal, that distinction, driven by identifying the poison, can literally be the difference between life and death, or between treatable damage and permanent disability.
That specificity is everything in that emergency moment. Okay. As we wrap up this deep dive, it's worth circling back to something you mentioned earlier, the increasing use of these hypercalcemic vitamin D-based poisons.
Yeah, because of that rodent resistance issue with older types.
Right, so these potentially more dangerous to pets poisons, or at least differently dangerous ones with that delayed effect, are becoming more common out there.
That's the trend, which raises a kind of broader issue, doesn't it?
Yeah.
Beyond just the immediate emergency care.
How so?
Well, it highlights this ongoing tension. On one hand, pest control needs effective tools, and these newer agents are effective against resistant rodents.
But on the other hand,
That effectiveness comes with a specific and perhaps increasing risk profile for our pets, especially when the symptoms and treatments are so distinct and require such specific knowledge from owners and vets. It really forces you to think about that balance between effective pest control and diligent pet safety awareness in your own home and community.
a difficult balance for sure. Knowing this information, being well informed, really is your best defense.
Absolutely.
And if you want to dig deeper into some of the specifics we touched on, like, say, the practical challenges vets face getting hold of calcitonin, definitely check out the source materials.
Knowledge is power here.
Thank you for joining us for this deep dive.